taught for years that if we used good technique when lifting and moving patients, we wouldn't injure ourselves. But caregivers around the world complain of chronic back pain. And debilitating injuries have forced some medical workers to leave the profession altogether. In fact, says the Bureau of Labor Statistics, nursing personnel are among the highest at risk for musculoskeletal disorders, along with nurses' aides, orderlies, and attendants. Researchers at NIOSH, the National Institute of Occupational Safety and Health, may explain why. Extensive laboratory-based research found that the human body is simply not designed to lift other human bodies. Forward bending required for lifting and moving puts your spine in its most vulnerable position, and even under ideal conditions, the weight of an adult exceeds the lifting capacity of most caregivers. In the next few minutes, we'll walk through some of the strategies NIOSH, along with other experts, are developing to reduce your risk for painful injuries and help you work smarter, not harder. Musculoskeletal disorders, or MSDs, are injuries to muscles, tendons, nerves, and spinal discs, resulting in low back pain, sciatica, and rotator cuff injuries. They happen when you strain your body beyond its safe limits, or do the same thing over and over again without giving your body time to recover. MSDs are typically an accumulation of many micro-injuries and tears that occur over months or years. There's no early warning. A twinge or a slight pain may be all that alerts you of an injury that gets worse over time. MSDs can also be caused by one single traumatic event, like trying to catch a 250-pound resident who's lost his balance. Risk factors for healthcare workers include force, the amount of physical effort required to perform tasks like lifting. Repetition, doing the same motion or series of motions continually or frequently. Awkward postures, positions that place stress on the body, such as kneeling, squatting, leaning over a bed, twisting your torso while lifting, or reaching above shoulder height. How do you know if you're developing an MSD? Pain that won't go away or disappears with rest. Stiffness, swelling, and/or pain in the back, neck, wrists, shoulders, forearms, or knees. Tingling, burning, numbness, or stiffness. Shooting or stabbing pain in arms, legs, or back, or inability to do everyday tasks. If you notice any of these signs or symptoms, report it to your supervisor immediately and see a qualified physician. Early diagnosis and treatment is the best way to avoid permanent disability in the future. It also helps your facility identify problem areas and find solutions. The question is, how can you protect your body and do the work you love? Plan your movements ahead of time so you can get help, either human or mechanical. Before you move or handle a resident, take a full risk assessment. Assess the resident's level of dependency. That's how much help he'll need to move. Your facility may use a checklist or an assessment form like this one. Is she totally dependent, or can she bear some weight and sit up with assistance? Or does she have considerable upper body strength and is able to pivot and transfer with limited assistance? Or does she just need some supervision and cueing? What about the size and weight of the resident? Is she unusually heavy, or is he frail? Assess for medical conditions that influence handling, such as indwelling catheters or residents who are weak on one side and not the other. Assess the resident's ability to assist you. Is she willing and able to cooperate with transfer or toileting? Does he suffer from dementia or Alzheimer's disease? If so, he can get combative or easily frightened, which can put both of you at risk of losing your balance and falling. Then, check the location. Look for risky locations in close quarters or barriers or cluttered bedside areas or hallways. A perfect example is transferring a patient to a toilet when space is limited. Will you need to stand in awkward postures or twist or stress your back and other muscles by combining reaching and lifting, and often twisting as well? Awkward postures when feeding and bathing residents or checking their IVs can stress your back. Rearrange your work area to eliminate bending and reaching. Make sure the tasks you do most often can be done at waist level. Now, decide what kind of equipment or repositioning aids you can use to make it easier on your back, or call on other coworkers so you can work together as a team. Document any special handling needs in your resident's plan of care. Update when a resident's needs change. Gather all needed equipment before you enter a resident's room. This way, you won't be tempted to perform a risky task because equipment is down the hall. Finally, communicate with your partner or team. Discuss and plan the procedure and decide on cues. Before you transfer or reposition your resident, tell her what's going to happen and what you need her to do. Keep instructions short and simple and use cueing when necessary. The goal? To make a safe, smooth transfer for the resident and prevent injury to yourself. You may have been using the two-person arm lift to reposition your residents, or the one-person through arm lift, even a towel or sheet under residents' thighs as a sling. These moves are hazardous, putting your lower back in a twisted position and you in awkward postures with an extended reach, a common cause of MSDs. Try these moves instead. Before pulling the resident up, the bed should be flat and side rails should be down. Bed height should be at your elbows. Height-adjustable electric beds have height controls for easy transfers from bed height to wheelchair height. Keep low for resident safety and raise for interaction with staff. If possible, avoid hand crank beds which can cause wrist or shoulder musculoskeletal disorders. If the resident is able to partially bear weight, encourage her to help you. Ask her to flex her knees and push on the count of 3. Use a friction-reducing device or at least 2 caregivers if she is fully dependent, or use a full-body sling. Slip sheets or roller sheets made of low-friction fabric glide to reduce friction while transferring residents laterally or repositioning in bed. They reduce the force you need to exert to move the resident. Coordinate the actions of all assisting by saying 1, 2, 3, go. How do you reposition your resident when he's seated? If your resident has good upper body strength, he can lift himself up while you push his knees to reposition. If your resident can't assist and the chair reclines, remove trays, footrests, and seat belts and lock brakes. Then, recline the chair and use a friction-reducing aid and at least 2 people to reposition. Do not pull from behind the chair. Cooperative residents with upper body strength can also reposition with the trapeze bar. Make sure bed is adjusted to your waist height and lock bed wheels and lower bed rails. According to researchers, the 2-person lift used to move residents from bed to chair is risky for your spinal discs and supporting tissues. The chicken or drag lift puts you at risk from standing in awkward postures and can cause shoulder dislocation in residents. The cradle or basket lift requires you to flex and bend sideways at the waist, and it's too much force for your spinal discs. If your resident is partially dependent with the ability to bear weight and she's cooperative, transfer toward her stronger side using a gait transfer belt. Walking or gait belts provide stability by allowing caregivers to hold on to the belt and support residents when walking. Remember to lower bed rails, remove arm and foot rests from chairs, and fasten the belt securely. Make sure a layer of clothing is between the belt and the resident's skin to avoid abrasion. Now, keeping her as close as possible to your body, use a rocking and pulling motion rather than lifting. Transfer boards made of wood or plastic can also be used to transfer residents from one level surface to another. Although 2 caregivers are needed, these boards can be used with residents who have good sitting balance and are cooperative, or those who require only limited assistance but need support. Remember to lock wheels on bed and chair, and make sure bed and chair are at the same height first. Use a small towel to cushion the chair. If your resident is totally dependent, partially dependent, or not able to bear weight, use a portable lifting device whenever possible. Electric or battery-powered lifts are better than crank devices and require less physical exertion by the caregiver. Devices like shower chairs that fit over the toilet can be used to move your resident from wheelchair to shower chair. Then toilet, shower, and transfer easily back to his wheelchair. You may have used the 3-person lift to transfer your residents from bed to gurney. This move forces you to bend forward at the waist while supporting a heavy load, a move that causes excessive strain on spinal discs, shoulders, and upper back. Instead, try these simple devices. When transferring your resident between 2 horizontal surfaces or repositioning him in bed, you can use a slide board. A slick board used under the resident to reduce the need for lifting. These devices protect against back injuries and conditions which cause pressure sores. Or use boards or mats with vinyl coverings. More than one caregiver is needed depending on the weight of the resident and his ability to cooperate. Make sure your transfer surfaces are at the same level, one that allows you to work at waist level to avoid extended reaching or bending of your back. When you use boards or mats with vinyl coverings, use a gentle push-pull motion as you move. If your resident is partially dependent and has some ability to bear weight, and she can sit up on the edge of the bed with or without assistance, you can use a gait belt. Or you can use a powered sit-to-stand or standing assist device, sometimes called patient handling slings. These are used for lifts when the patient must stand and then pivot. Stand assist devices can be fixed to bed or chair or be freestanding. Make sure the device is rated for the resident's weight and stable. For residents who are totally dependent, immobilized, cannot bear weight, or are heavy, you can use a portable lift device or use a ceiling-mounted lift device operated by handheld control. Make sure it's rated for the resident's weight. Whether you're lifting in teams or using equipment, some manual lifting is still required, and using good body mechanics is important, with or without equipment. Your posture is key to preventing injury. Drop an imaginary line from your ear to your hip bone to your ankle. Keep that line as straight as possible. Spinal discs can handle heavier loads when the back is straight. That means keeping your work close to your body. If an object is at a greater distance from your body, your back muscles and joints have to work harder to lift, creating greater stress on your back. If you keep the load close to your body, it creates a lighter load and less stress on your back. When you need to get close to the floor, bend your knees, not your back. And when you reach, such as when you make a bed, walk around the bed instead of leaning across it. Maintain a wide, stable base while standing or lifting. Keep your feet below your shoulders and your shoulders over your hips. To turn, move your feet, don't twist your back. Spinal discs are weaker when lifting is combined with twisting. Try to think of your hips and shoulders as a unit. Keep them aimed at the work you're doing. Avoid heavy lifting, especially with spine rotated. Discs are weaker when lifting in a flexed position. We know that working in healthcare can be hard on your musculoskeletal system, but NIOSH, along with the American Nurses Association and other occupational safety experts, are hard at work to find real solutions to patient handling so you can do the work you love without risking injury. It's your responsibility to learn to recognize risky tasks in your daily work. Then, change the way you do these tasks. This kind of preventative approach helps you reduce your chance of developing a musculoskeletal disorder, including a back injury. To protect yourself, minimize manual lifting whenever possible. Your goal should be zero injury. When you must transfer or move a patient, get help, either human or mechanical, but make sure you know how to use the devices correctly. Unless you're totally comfortable using equipment, your residents will resist and your back will suffer. Keep the equipment readily available and in good repair. While traditional lifting techniques are proven not to work, safe lifting programs that include equipment and repositioning aids are changing the working conditions for caregivers around the world. Do your part. Work smarter, not harder. Ask for help. Always get a cart to put something heavy on. And if you think it's too heavy, don't lift it.